This is JAPI, and welcome to JAPI Podcasts.
I am Dr. Nihar Mehta. Welcome to JAPI Podcasts of April 2025, issue of JAPI Volume 73, Issue 4. This issue of JAPI has some really interesting articles, including 7 original articles, 3 review articles, 1 point of view, 4 unique case reports, 1 pictorial CME, and 1 letter of correspondence. Let's discuss some of these in detail. Let's start with the first original article, which is on the spectrum of thyroid disorders in rheumatoid arthritis by Megha S. Kumar et al. The objective of this study was to evaluate the prevalence and the pattern of thyroid dysfunction in rheumatoid arthritis patients, to compare the disease activity amongst RA patients with thyroid dysfunction to those without thyroid dysfunction, and of course to study the association between severe RA and thyroid dysfunction. So this hospital-based analytical cross-sectional study was done in 165 rheumatoid arthritis patients in an outpatient basis between January and December 2019. Now, the results of this were really interesting. The prevalence of thyroid dysfunction amongst RA patients was 38.2%, the most common disorder being subclinical hypothyroidism, which was seen in 33.3% of the study population, 1/3 of all patients. Overt hypothyroidism was seen in 3.6% of the patients. There was a significant difference in the mean age between RA patients with thyroid dysfunction and euthyroid patients. There was no significant association found between the duration of rheumatoid arthritis and thyroid dysfunction. RA patients with thyroid dysfunction had elevated inflammatory markers compared to those with normal thyroid function, and the prevalence of autoimmune thyroid disorders in RA patients was 24.8%. There was a significant association between disease activity and thyroid dysfunction. Patients with thyroid disorders had severe disease compared to those with euthyroid patients. Now, to add to this, a significant positive correlation was noted between the serum TSH and the disease activity score 28, and also between the anti-TPO antibody titers and the disease activity score. So what does this tell us? Number one, that thyroid dysfunction is quite prevalent in rheumatoid arthritis patients, the subclinical hypothyroidism being the most common. Number two, that rheumatoid arthritis patients with thyroid dysfunction have higher disease activity than euthyroid patients. Therefore, thyroid function tests should become a routine investigation for all rheumatoid arthritis patients, and if found abnormal, they should be treated appropriately. Let's move to the next original article, which is a study of the bedside diagnosis of bacterial meningitis using urinary strip reagent for semi-quantitative analysis of the cerebrospinal fluid. This study was done by Bhavya C. et al. Early and accurate diagnosis of meningitis is crucial for initiating timely treatment and improving patient outcomes. Now, we know that the conventional CSF analysis, which includes microscopy, biochemical tests, cultures, and molecular diagnostics, these remain the gold standard for diagnosis. But these methods require a laboratory infrastructure, trained personnel, and time, which will not always be available readily, especially in our resource-limiting settings. A rapid and cost-effective bedside screening tool would therefore bridge the gap by allowing early identification of suspected cases and facilitating prompt clinical decision-making. So this really interesting and practical study aimed to evaluate the diagnostic performance of the Siemens multi-stick 10SG reagent strip as a rapid screening tool for CSF leukocytes and protein levels in those suspected of meningitis. 100 patients were evaluated between 2019 and 2021, and the CSF samples were collected, analyzed, as well as the reagent strip was tested. Amongst the patients studied, 48% had CSF pleocytosis, defined as the white blood cell count more than 10 cells per cubic millimeter, while the reagent strip was used to detect leukocytes at a cutoff of more than 10 cells per millimeter squared. This demonstrated a sensitivity of 95.8%, a specificity of 63%, a positive predictive value of 73%, and a negative predictive value of 94%. The overall diagnostic accuracy was 81%. What if a higher cutoff was used? So, when the cutoff was more than 100 cells per millimeter square, the sensitivity went down to 69%, but the specificity went up to 97%, with a positive and negative predictive value of 90% and a diagnostic accuracy of 90%. For protein estimation, standard laboratory analysis identified 40% of cases with CSF protein levels exceeding stop. For protein estimation, standard laboratory analysis identified 40% of cases with CSF protein levels exceeding 100 milligrams per dl. The reagent strip test for proteins, when compared to the biochemical reference at 100 milligrams per dl cutoff, exhibited a sensitivity of 90% and a specificity of 70%, and positive predictive value of 66% and negative of 91%, with an accuracy of 78%. Now, what do these findings tell us? So many numbers here. The findings tell us that the reagent strip test is highly sensitive and a rapid method to detect the CSF pleocytosis and protein elevation, making it a valuable screening tool, particularly in the setting with limited access to facilities and infrastructure. However, its moderate specificity indicates that there is a potential for false positives, which highlights the importance of using it as an adjunct, not a replacement for conventional CSF analysis. So the reagent strip test can be particularly useful in an emergency or a peripheral healthcare system where immediately laboratory-based CSF analysis is unavailable. The next original study is a comparative study of the efficacy and safety of dapagliflozin versus basal insulin in stabilizing the glycemic variability in patients with type 2 diabetes inadequately controlled on the triple drug combination therapy. This was done by Deepak S. Bhosle et al. Now, this study aimed to answer one question. What do you add as the fourth therapy? Should it be dapagliflozin or basal insulin when you are already on triple drug therapy? And how did this study do this? By comparing in the two groups the glycemic variability. So this was a 1-year prospective randomized open label single center interventional clinical study. 100 patients of type 2 diabetes on triple drug therapy randomized into two groups. 50 received dapagliflozin and 50 received insulin glargine as the fourth glucose lowering agent. The Freestyle Libre Pro ambulatory glucose monitoring sensor was used to study various parameters: the coefficient of glucose variability, time in range, time below range, time above range, the glucose management index. And what was the result? it showed that there was a significant reduction in the values of the glycemic variability parameters and the coefficient of the glycemic variability, as well as the baseline glycemic parameters like fasting glucose, postprandial glucose, and the glycosylated hemoglobin in both groups. But the salient feature, please note, was that the patients who receive insulin glargine as the fourth glucose lowering therapy observed to have fewer glucose excursions than those who receive dapagliflozin, as estimated by most of these parameters. So, to the answer of the question that was posed by this study, insulin glargine should be the fourth glucose lowering agent on the background of triple therapy because it has demonstrated a significant reduction in glycemic variability compared to dapagliflozin. The next original study was on obstructive sleep apnea. Screening for OSA by standard recommended tools and its associated comorbidities in a subset of the Eastern India surgical population. This was an observational study by Anisha Ghosh et al. Now, we do know that the obstructive sleep apnea hypopnea syndrome has a prevalence much more than is recognized, nearly 13 to 19% in India. Up to 92% of women and 82% of males with moderate to severe sleep apnea remained undiagnosed. This has particular implications when these patients undergo general anesthesia or deep sedation, which can predispose them to our upper airway obstructions, resulting in perioperative and postoperative complications, rapid desaturation, longer hospital stay, longer and unexplained intensive care unit admissions, even higher mortality rates, all in addition to the cardiac, respiratory, and neurological complications. So, this study was done in 527 patients from January 2018 to January 2020. And the objective was to assess the burden of obstructive sleep apnea hypopnea in the preoperative population in this part of India, so that at least some less time consuming tools can be incorporated in the pre anesthesia checkup to plan the intra and post-operative management. 4 screening tools were simultaneously used to detect the presence of the obstructive sleep apnea in the subjects, and they were matched by the administration of stop bang, Berlin, and PSAP screening tools in conjunction. Amongst the combination of any of the two tools, the stop bang and the PSAP established OHA in 74.3% of the respondents, whereas individually the highest number was observed in the PSAP score, that was in 67% of the individuals. So what does this study tell us? That sleep apnea is frequently encountered in surgical patients. It's associated with several factors like aging, BMI, increasing neck circumference, a thyromental distance less than 6 centimeters. The stop bang and PSAP combination is the best and most convenient choice for screening of OSA in as per the authors, as it is less time consuming, highly sensitive, and the authors recommend that this should be routinely incorporated in a pre-anesthesia checkup. Let's discuss the next original article, a retrospective study of clinical characteristics and serological profile of male systemic lupus erythematosus patients in India. This study was done by Abhishek Kumar et al., and it reports various clinical parameters in SLE patients who are males. This was a retrospective study of 5 years, a cohort study done in a tertiary rheumatology center in North India. Data on the clinical features were retrieved, including the follow-up, the immunological profiles, the treatment received, long-term complications, 45 patients were included in the study, of which 2 were juvenile lupus. Mucocutaneous manifestations were the most common clinical presentations and minor organ involvement. Amongst major organs, renal involvement was the most common, followed by hematological manifestations. 2 of the 45 had thrombotic manifestations, 4 had overlap with other connective tissue disorders. Of note was hypertension was the most common complication which developed during the follow-up, followed by avascular necrosis of the femoral head. 2 patients died in follow-up, 11 were treated for antiphospholipid syndrome, of which 1 lupus anticoagulant positive patient had thrombotic complications. All were ANA positive, had a speckled pattern being common, and anti-dsDNA was the common antibody. What about the treatment? Well, all patients received hydroxychloroquine and low-dose steroid, as well as 35% received steroid-sparing agents. Most patients with lupus nephritis took more than 1 year to achieve a clinical remission. This study showed that the male SLE patients are at high risk of severe organ damage at an earlier age and are susceptible to various other complications during follow-up. This may differ from female SLE patients, and larger studies in the future should be conducted on male SLE patients to understand the differences between the male and the female SLE patterns. The next original article studied the correlation of vitamin B12 and muscle enzymes with the severity of the Guillain-Barré syndrome and its prediction in respiratory failure. An interesting study by Vinod Singh Jatav et al. Now, many biomarkers have been used to monitor the progress of Guillain-Barré syndrome, that is GBS, including folate levels, albumin levels, glucose, serum sodium, plasma cortisol levels. This study evaluated the prevalence of B12 deficiency as well as increased creatinine kinase levels in GBS patients to see if either of these could be used as prognostic indicators in the GBS patients. 50 patients were evaluated between 2020 and 2021, and the study assessed the patient's motor function deficits using the MRC scale as well as the HDS scale. The vitamin B12 and creatine kinase levels were measured. Patients were divided into 4 groups, one of which had deficiency in B12 and a raised CK level, while the other groups had normal B12 and CK levels. The patients were divided into groups, one of which had a deficiency of B12 and a raised CK level, while another group had normal B12 and CK levels. Clinical characteristics were compared, and the results showed that serum B12 deficiency, along with elevated CK levels, were discovered in 44% and 14% of the patients respectively. While the B12 deficiency correlated significantly with the GBS severity, the CK levels did not. This included progression duration, admission, the scores, as well as the autonomic dysfunction. So this study gave us a very interesting, simple conclusion that in our patients of Guillain-Barré syndrome, vitamin B12 levels can predict the prognosis. A simple test to be done for our patients with GBS to evaluate their outcomes. The next study was an original article on the role of sequential approach to sample collection in microbiological diagnosis of smear-negative pulmonary tuberculosis by Kirti Kadian et al. The current diagnostic tools for pulmonary tuberculosis have several pitfalls in the detection. being able to detect only 43% of cases, leading to inappropriate use of antibiotics and delayed diagnosis. Induced sputum and bronchoalveolar lavage are more accurate in terms of their samples, but their use is not clearly recommended. This study evaluates the real world feasibility and effectiveness of using a sequential collection system of respiratory samples to diagnose pulmonary tuberculosis. Pulmonary tuberculosis cases with sputum scarce or sputum smear negative status were included. Sputum induction and bowel samples were collected. The authors used a composite reference standard method as the reference. 220 patients were screened, 156 were enrolled, 80 cases underwent successful sputum induction, whereas 76% failed. 53.7% of the cases who underwent successful sputum induction were positive for Mycobacterium tuberculosis by cartridge-based nucleic acid amplification, the CBNAT. Of the 112 cases that underwent the flexible optic bronchoscopy, 85 were detected for pulmonary tuberculosis, of which 8 were detected rifampicin resistant by CBNAT in the bowel samples. The remaining were found to have alternate diagnosis. Using this sequential approach, CBNAT has a higher cumulative sensitivity of 97.72% and a specificity of 100%, the diagnostic accuracy being 98%, as compared to either smear examination or culture. 27.5% of cases were able to avoid bronchoscopy using this sequential technique. To conclude, the sequential technique of sample collection increased the bacteriological confirmation of pulmonary tuberculosis and should be implemented widely in our setting. We next come to review articles, the first of which is implementation on strategies to improve survival outcomes after out-of-hospital cardiac arrest, Global Challenges and Disparities, by V.S. Murthy et al. Now, the scope of out-of-hospital cardiac arrests is quite large, with an estimate of 3.8 million people annually being victims of an out-of-hospital cardiac arrest. The global survival averages at around 10%, ranging from 3% to 20%. Survival is higher, up to 47%, when arrests are witnessed and present with a shockable rhythm. The chain of survival comprises of early recognition, rapid EMS activation, high-quality bystander CPR, prompt defibrillation, advanced EMS care, and great post-resuscitation treatment. Now, what are the disparities and the barriers amongst countries? High-income countries report CPR training rates of 50%, which is twice that of upper middle-income countries, which is around 23%. Barriers to bystander CPR include many factors: limited knowledge, limited skills, fear of causing harm or infection to the patients, legal concerns, and the bystander effect. Gender, socioeconomic, and racial disparities also influence who receives bystander aid. There are some strategies to improve the bystander response, including dispatcher-assisted CPR, telecommunicator coaching, which increases early compressions, mobile alert systems to notify trained volunteers nearby, innovative training, short and competency-based courses like 30 minutes hands-only CPR, school programs, public campaigns, mandating CPR education in high schools, and mass media initiatives. The next point includes public access defibrillation. Early AED use within 3 to 5 minutes can increase the survival to more than 70%. Strategies to include strategic AED placement, drone delivery, registries, and public education should be implemented in a widespread manner. The EMS and the post arrest care should be optimized with faster response times, high quality on scene resuscitation, and transport to specialized centers to improved outcomes. In addition to this, we should establish national and regional out of hospital cardiac arrest registries, which are vital for continuous quality improvement and international benchmarking. India currently lacks a comprehensive national registry. The impact of the COVID-19 pandemic also led to an increase in the out of hospital cardiac arrest incidents, with longer EMS delays, reduced bystander interventions because of fear of infection, and poor overall survival. This review article recommends the next few things. Number one, tailor interventions to the community context. Assess the local EMS capacity, public awareness, AED availability, legal framework, and funding. Number two, implement competency based CPR training, dispatcher assisted protocols, mobile first responder alerts, and PAD programs. And number three, establish national cardiac arrest registries, strengthening the EMS infrastructure, and mandating Good Samaritan protections to foster international research collaborations. To conclude, by reinforcing each link from the lay rescuer to the post arrest care and addressing resource and training gaps, survival after out of hospital cardiac arrests can be significantly improved worldwide. The next review article is an extremely interesting concept on pre-hyperuricemia. Pre-hyperuricemia deserves more attention in this era of metabolic explosion by G.R. Subbu et al. The global population is experiencing a metabolic explosion with the prevalence of hyperuricemia as a metabolic disorder and causal factor for non-communicable diseases, which has increased rapidly worldwide over the last 2 decades. This rise is attributed to diets high in purine, alcohol, red meat, high fructose foods, and lifestyle changes. The connection between hyperuricemia and non-communicable diseases is stronger than ever. As the hyperuricemia progresses, systemic inflammation arises, leading to endothelial dysfunction, end organ damage, molecular changes that were previously unrecognized. Hyperuricemia is increasingly seen as a metabolic disorder, particularly a vascular disorder, rather than just a crystallization disease. Now, asymptomatic hyperuricemia is no longer considered benign and should not be equated with gout. It is crucial to diagnose hyperuricemia early, even at a high normal stage, and manage it to prevent the development and complications of the related extra-articular diseases. Therefore, for broader recognition and significance, the high normal uric acid levels should be termed as pre-hyperuricemia, an interesting terminology. Just like we have pre-diabetes and pre-hypertension, pre-hyperuricemia should be identified early, regardless of the age and the sex, with preventive actions implemented to maintain the uric acid levels and the metabolic health at a safer level. The next review article by Nagendra K. Singh et al. Is a consensus to reduce the withdrawal and improve adherence with SGLT2 inhibitors. The consensus 2 SGLT2 inhibitor adherence group. The objective of this was to identify reasons for non-adherence to the SGLT2 inhibitor therapy and to suggest strategies to improve this adherence. This study is based on an expert consensus involving 14 diabetes specialists along with an analysis of literature and patient data on adherence challenges. What were the factors affecting non adherence? The first was adverse effects. Common issues like genital infections, dehydration, ketoacidosis were important factors. Cost related barriers, high medicine prices limit the long term use. Number three was the lack of awareness. Many patients do not fully understand the long term benefits of the SGLT2 inhibitor therapy. And the last was fear of rare side effects. Misconceptions about the risks, such as Fournier's gangrene, discourage adherence. What were the strategies suggested to improve adherence? Firstly, patient education programs, increasing awareness about the benefits and risks of SGLT2 inhibitor therapy. Second, cost reduction initiatives, insurance support, and promotion of generic alternatives to improve accessibility. Thirdly, regular follow-ups, continuous medical monitoring to manage and mitigate side effects. And lastly, personalized treatment plans, tailoring therapy to balance benefits and risks for individual patients. To conclude, SGLT2 inhibitors offer significant benefits but are underutilized due to the adherence issues. Enhanced education, financial support, and medical monitoring can improve treatment success. Further research is needed to develop long-term adherence strategies. Thank you for listening to JAPI podcasts.